Today we're learning about the death of a child in Texas. It's the first death from measles in this country in a decade. It was an unvaccinated child in West Texas, where an outbreak with at least 124 reported cases since late last month. The death is particularly alarming since America declared measles eliminated a quarter century ago, thanks to tireless research and mass vaccination efforts. Now it's back. And today, our brand new Secretary of Health and Human Services, Robert F. Kennedy Jr., probably best known for spreading anti-vaccine propaganda, is in charge.
We're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year in this country. Last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Well, no, that's not quite true. Actually, first of all, it's only February, but it is highly unusual. A child is dead from a disease that has not killed anyone in this country for 10 years. That is unusual. It's also not true that the 20 hospitalized kids are there mainly for quarantine. What the head of HHS said to the nation about a measles outbreak was not true. According to the chief medical officer in Lubbock, Texas, they're being treated. All were admitted because, quote, they were having trouble breathing. This is a real nightmare scenario, something people warned about as Donald Trump floated tapping RFK Jr. to lead HHS, pointing to his involvement in a deadly measles outbreak in Samoa back in 2019. Listen to this from a PBS documentary.
Yeah, I'm aware there was a measles outbreak, but I didn't have anything, I have nothing to do with people not vaccinating in Samoa. I never told anybody not to vaccinate. I didn't, go there for any reason to do with that.
One News has learned of a high-level anti-vax meeting just before this deadly measles outbreak, a meeting between vaccination critic Robert Kennedy Jr. and anti-vax blogger Taylor Winterstein.
That right there is the guy charged with monitoring this new measles outbreak here in the U.S. after the first death in a decade from a disease once considered eradicated. Are you better off now than you were 4 years ago? Dr. Peter Hotez, the co-director of the Center for Vaccine Development at Texas Children's Hospital, also a dean of the National College of Tropical Medicine at Baylor College, author of The Deadly Rise of Anti-Science, a Scientist's Warning, and he joins me now. Doctor, it's great to have you. It's under terrible circumstances. You have been working on vaccines, battling vaccine disinformation, and warning about it in Texas, specifically where you live and work, for over a decade now. What's your reaction to all this?
Yeah, this is heartbreaking, Chris. I mean, this is a school-age child who was unvaccinated. This child did not have to lose his or her life. And the problem is we're still in the early stages of this. This is a very large and dangerous measles epidemic. The reported number of cases is over 100, 124. It's now spilling over into the adjacent county in New Mexico. Possibly it'll go up into Oklahoma. This is still in the early stages because remember, the measles incubation period is 2 weeks. So this is what we're hearing about now, but we're going to have to wait 2 weeks to see what the next crop is. So this is likely hundreds of cases. A lot of them are not going diagnosed. Kids are piling into the hospital, and the worst nightmare of all, having a measles death. 20% of kids with measles in the United States require hospitalization, Chris. And they don't do it for quarantine. They do it for measles pneumonia, which is a giant cell pneumonia, which is a life-threatening infection. They do it for measles diarrhea, which causes acute dehydration. They do it for measles encephalitis, which is life-threatening. They do it. They're hospitalized for deafness resulting from measles otitis, ear infection, and hospitalization. This is a bad actor, and I'm really concerned that this thing is continuing to accelerate and expand.
You know, one of the things we've seen in Texas, we have this chart of the sort of exemptions from vaccination, personal belief exemptions over time. You can see them just skyrocket up, obviously. And when you get below that 95% herd immunity, that's where, the outbreak here in this case started in the Mennonite community. They don't have a theological objection, I should note, to vaccination. But because it's a community where people don't go to public schools, they're not running into the vaccine requirements. There's low vaccination rates. And it just strikes me that, this is why herd immunity is so important, right? Because if you have herd immunity, then if you have small religious community that's sort of outside of the public school system, they're protected by everyone else's herd immunity.
Well, it's starting in a small religious community that really has no prohibitions against vaccinations. I mean, what's happening is in Texas, we have a very aggressive, predatory anti-vaccine lobby that actually receives PAC money, Political Action Committee money, to do their work. And that really concerns me. And so even though it's starting in the Mennonite community, it's expanding pretty rapidly, I think, into other parts of West Texas where vaccination rates are also low. And you know, it's the parents themselves are in some ways victims. They're because they were targeted by anti-vaccine activists for this purpose.
We obviously have an anti-vaxxer now who is the head of HHS. And there's three headlines I saw today. HHS halts oral COVID vaccine trial. Kennedy has paused a multi-million-dollar contract from the Biden administration to create a new COVID-19 vaccine that can be taken orally. So for folks that don't like shots, and there's some evidence to suggest shots are actually a fairly big impediment, they've paused that. Bloomberg today, Trump team weighs pulling funds for Moderna bird flu vaccine, part of a government push to examine spending on RNA-based vaccines. That contract's already signed. It's unclear they could take the money back, but that's happening. And then this last one. FDA flu shot meeting canceled. Food and Drug Administration Vaccine Advisory Committee meeting scheduled for March to select the strains be included in next season's flu shot has been canceled, a panel member said Wednesday.